I'm called Stephen Okal, and an orthopedic technologist and also a health promotion officer. I'm working in Kakamega County, Malava Sub-County Hospital, and I love my job. So I think I have two careers. The first one, as I said, is orthopedic. Orthopedic, I got interested because I see children born with deformities or disabilities, then I correct them. I see people who have lost their limbs. I make for them a prosthesis and I correct their disabilities. So it makes me feel good. Then with health promotion, how I interact with the community, how I do this, organize for these medical camps to ensure that at least every person get access to healthcare services. It makes me feel good. Yes. Satisfying most is when I see people happy after getting my service. For example, if I got someone who lost their leg and I make for them a prosthesis of the artificial limb, then they start walking, I feel satisfied. I see a child who was born with deformities, I correct their deformities, then they live without disability. I feel so good, I feel so satisfying. Now with this one, when I see community get help, I don't like to see a sick community. When I see people get this medicine, they get health services, I feel more satisfied than any other thing else. Yes. What I've not found, I was expecting that when I was going to do orthopedic, I would do everything in orthopedic, but I came to realize that orthopedic has different departments, so I'm not able to do surgery, and that's what I came to realize that it's not. I was expecting that my career would be like all-rounded in all aspects of orthopedic, but now I came to realize that it's more specific into rehabilitation, and after all, I've come to love it. Yes. I have challenges that some patients still do not accept their disability, so it takes me a lot of time to convince them, to create awareness, and to make them know that at least with their disability they can always get better. Another aspect, challenge that I have with the community program is that we don't have funds that can help us mobilize the community, provide medications for them. So those are the challenges that I really face in my profession. I would wish to provide services, but patients are not able to afford some of these services. So I feel so bad. Okay, as a medical person, I must save myself first. I must protect myself first before I protect another person. So in terms of wearing mask to protect myself from infection, yes, I do. I put on gloves to protect myself from getting contaminated infections. And also I do a lot of nutritional support so that I'm also not getting sick. I cannot treat people when I'm sick. So I do a lot of self-care to myself. I protect my bones first before I can help some people protect their bones. Yes. Honestly, when I change my career, when I change locations of work, I was initially working at. I first worked at Kakamega Hospital, General Hospital. I got a lot of company. I loved people there. I loved my patients, and I got used to the environment. So when I was moved to Ikolomani Sub-County again, I had to make a new company, get new people. I felt a bit hard. Then also when I moved from Ikolomani now to Malava, it's also another environment that I have to adapt with. So those are some of the things that made me feel a bit uncomfortable. Then Challenges also with work. I mean, you get some patients who are do not understand really. They take a lot of time to understand what you want to do to them. Sometimes they don't believe you, or they have that stigma, and it makes you feel like you're not really helping them. You don't feel satisfied with your service. Yeah. Okay, I deal with orthopedic, and mostly in terms of orthopedic, my cases are seen. Somebody gets an accident, and you go for an X-ray, you see a fracture. So it's just a matter of letting the patient see the fracture, the X-ray, and feel that there's pain. So there are those complicated fractures that need surgery, or those that may need amputation, like cutting off the limb. So it takes you a lot of time, because you have to counsel the patient, you make them understand their present condition and what I want to do to them to make them feel a bit better. At certain occasions where we get patients who have cancer, bone cancer, and you have to break the bad news to them that they're having a bone cancer, and it's a bad disease, in quote. So I have to always counsel the patient first, make them understand their condition, then sympathize with their situation, then give them the benefit of your aftercare. Then I just break the news to them, but it takes time. I just don't do it immediately, because there are things that comes along. You can just break a news to a patient, then they get into shock, or they get some heart attack, or blood pressure goes up. So you just have to do a lot of counseling. Then you see when to break the news to the patient. When I'm doing health promotion, I'm also meeting the community and giving them news. For example, you get a patient who has maybe HIV, and you need to give them the news that they are positive, or diabetes. So still the same way, we are trained on how to do the counseling. Then after the counseling, you know when to even involve the relatives. Yes. Thank you very much, and you always remember to subscribe to that channel, and like and share with your friends.